October 2024, Zambia celebrated 60 years of independence from colonial rule. After her independence, landlocked Zambia actively participated in the liberation wars of her neighboring countries, which were involved in bitter civil wars such as Angola, Mozambique, Zimbabwe, Namibia, and South Africa, until they all attained self-rule. Zambia has been and is still a leading light in the fight against diseases, hunger, and illiteracy. Zambia is embracing a technological revolution that promises to transform lives and communities. As the world rapidly evolves, so too does Zambia, leveraging the power of artificial intelligence to address its unique challenges and unlock its potential. In Zambia, access to healthcare is no longer a challenge, particularly in remote areas. Dawa Health is breaking barriers through telemedicine, connecting patients with doctors and providing vital health services through technology.
Maternal mortality is still a big problem, so we decided to build a product that's focused on that. So it's looking at trying to reduce maternal mortality.
Next, we visit AgriPredict, where the future of farming is taking root. By harnessing data analytics and AI, this innovative startup is revolutionizing agriculture, helping farmers make informed decisions that boost productivity and sustainability.
Our mission really is about developing tools for farmers to help them thrive.
As this visionary companies forge ahead, local businesses are also tapping into technology, enhancing their operations and reaching new customers. Together, they are creating a vibrant ecosystem that fosters innovation and collaboration. Join us as we explore the stories of resilience, innovation, and the human spirit in Zambia. This is more than just a documentary. It's a journey into the future, where technology meets opportunity and hope flourishes.
Sing of Zambia, proud and free.
Muchila, Zambia, a typical rural town a couple hundred kilometers from the capital, Lusaka. Children walk from the bush to get a simple education. Not much traffic from the village merchants. The town's lone medical facility sees to a trickle of patients. The village headman's typical day sees him chatting with the hospital's chairman as the daily scene unfolds.
Bube kula mburi nini chintolo chakari kule kachiri kori akwiwe kwa haba bwo kuri ba branch kutwakari kula chintolo twakari kwenda misinzo chitanama kilometers unga 13 kilometers njitwari kwenda kwa kula ku chintolo bantu kale bari kupona bari mi bube bari kuri mama tashi kakwine ngombe magana kutika kuliruka kono.
While Muchila still seems like a quiet village, one need not look very far to see that there are changes brought by technology from China.
Kwa jincha kuti Muchila yabota kambo batubikira ma network batubikira ma solar batubikira matanka amenyi onse kale twali kunwo mikalo.
In July, the Chinese technology giant Huawei signed a deal with the Zambian government to equip 100 smart villages across the nation. And Muchila was chosen to go first. Quickly after the announcement, the equipment came. Solar panels to give the village its first steady flow of electricity. A master to connect residents' phones and provide internet connections for scholars, researchers, and even farmers. Money started to flow in electronically, helping small business people like Obvious Manyanya.
Enzo vuta kaili kwezelepe ma network ezo vuta but through muri bawe apa manje tukwasa kulandira vintu vocha kuli munzanga munga ndalama anganipasa through mu mobile money tu nganifuna checking up haircut.
It didn't take long for business owners like Gift to see the need to expand his services.
Matariro business yagali kushupa magani akubola network so twali kujana buyumuyumu auti utumihe hintu town utegwa ode taumbweji ni muntu chabola wanda gushamali wina problem iligo janiga ati yonse ni ma transaction arenda awunyina awubyabi buri bope so hintu honse anumazuba bogoa.
However, the institution that has seen perhaps the most dramatic effect is Muchila's school.
When I joined this school in 2021, May, I found to be one of the remotest schools in the district. And at that time, the school was not up to date in terms of internet connectivity. People were shunning away. Teachers were shunning away from working from this station. It seemed to be like a dream when we heard the news that Awe was coming to Muchila, considering the history setup, its remoteness. So by the time when we received our way, that's when we came to believe that it was a reality. And within a space of time, they managed to erect a tower. Thereafter, from there, we saw an advent of the solar plant and Idea Hub. Even teachers were puzzled about what is this about, what about Idea Hub. But when it was unveiled to us and to see what it can offer, there's research for the teachers. They can do what we call teacher group discussions interactively with the people from Lusaka, people from Kalomo, sharing educational information. The same, the teachers have also initiated, they have oriented learners. Those who are literate are able to use the facility they have. From the time I came here in 2021, May, up to now, 3.5 years, the number enrollment for this school was 311. Now it is over 855. We are ranked among the worst performing schools in terms of national assessment results. But from the time this one was done, there's a sharp increase.
It is a far cry from what this school looked like 14 years ago when Bridget first came here to teach.
When I arrived here at Muchila, I almost cried. It was a bush. There was totally nothing. Even the school, when I reported, there was just one block, 1x3 block. When I came to class the first day, the learners were seated, there were no desks. They were seated down. So it was a village, really rural, remote. The village has really transformed, especially in the sense that when I came here, there was no network. There was a place we call Changa, which is about 4 kilometers from here, where we could go, every one of us, even the villagers, even the teachers, we could crowd there just to make calls and receive calls. But this time we are able to receive calls anywhere we are, be it in class or home. So even internet we are able to use because it has transformed technologically. People have become technologically literate.
The digital board smart hub technology, I think is a good system, especially in rural areas. Here, Muchila is regarded to be a rural place. So with the coming up with the system, it has helped to instill technology, especially to our learners.
We are able to Google information now. So everything which we want to learn, we are able to get it on the internet.
We can learn more on the digital hub, the one we don't learn in previous years. We now learn we can even communicate with our friends at different schools. The difference is that we were not able to study at night, because right now we are able to come and study at night. It's good.
At Gift's house, one can see proof that power does lead to more studying, as he and his daughter do her homework.
Electricity.
Gift's store has done so well since Huawei smartened the village that he has set up for his wife with her own shop. This is a scene you couldn't have seen when 2024 started. The local clinic is open at night.
I came before the technology and would have challenges because we never had power. We would use our phones to light up during the night, which wasn't easy. It was hectic because during a delivery you need someone to help you to light up a torch using a phone, and if your phone is not charged, meaning you have a challenge, you would need candles. We haven't recorded any in a long time, which is a good thing because it's because of this technology we're able to track our mothers in the community and we're able to give them good care. Because of the power that we're given, we're able to even keep our own premature babies that are born before term, because we have an incubator that is operating now. It never used to operate because of power, but now it's operating. We even have patients that come from other clinics. They prefer coming here to seek our services because they have heard there's a good continuity of care here. Things have improved and we offer good services.
It's not just about being able to keep late hours. Technology is improving the quality of care at rural hospitals throughout the world, but especially here.
It also helps in diagnosing the condition the patient has, depending on the type of presenting symptoms the patient is having. So it has really helped. It really guides on what the patient is suffering from and the right treatment to take. So the computer has really helped us, and all this is due to the network, the good network that we have.
It's not just doctors and patients, teachers and students. merchants and service providers. So many of the residents of Muchila find their lives just a little bit better.
Oh, it has really done great to Muchila village. We really appreciate.
Thanks to Huawei and technology, lives are getting better in Muchila and throughout Zambia. Farming in Zambia is not easy. Only about 1/7 of the country's land is used for agriculture. The sector is hurt by limited access to quality inputs, mechanization, and financing. Farmers here are heavily reliant on rain to water their crops, and climate change has instead brought drought. There is no magic way to refresh this land. But technology can bring farmers information that can improve their situations. A local company called AgriPredict has been supplying that information through its mobile applications for the past 6 years.
I understand the weather, which weather predict, and I'm able to buy the right type of seed and plant at the right time. Last year, I had a problem saying some of the farmers, my neighbors, they were used to plant at the traditional level, saying wherever the land is ready, we shall just plant. My friend planted a lot of kgs and the fertilizer went out. Then myself, I waited for 2 weeks and I went on the field saying, no, my wife, let us just plant. The weather 404 has told me that this week will be rain.
The AgriPredict mobile application uses both traditional focused and artificial intelligence estimations to help Zambian farmers overcome many challenges.
First started in 2019 in response to the fall armyworm, which wasn't the first time it hit Zambia, but it was the first time that it was to an extreme level. I remember that season it was on the news every day of what is being done, of stories we're hearing of small-scale farmers that were heavily impacted. Their yield was completely destroyed. And just the process of trying to mitigate that whole situation just showed a lot of inefficiency.
Despite almost 6 years of successes, this system is a work in progress.
This is Chongwe district and the name of the village is Molalika. So today we are here to collect feedback from the farmers on how the services have helped them through the last growing season and how they are planning to use the services for this next growing season.
The app has 3 functions. Providing weather forecasts is one element. Giving planting advice based on soil quality and other factors is number 2. The third helps match produce to buyers.
That allows farmers to be able to list the produce that they want to take to market, but also buyers can list the produce and then we match the sellers with the buyers and we do send out notifications whenever a match happens.
Farmers also get advice on pest control. Gordon has not been a farmer for very long, but AgriPredict quickly brought him up to speed.
I started farming with a poor note by not knowing what to do. Immediately I understand the 404 applet did predict. I started growing my farming.
His neighbors soon discovered his secret.
Kuziva chiri chonse moshangira moshitira chani, but by this time naziva mosebenzesera paka nashanga kudala nezo kungoshangira mochabe monga monga rate nezo shanga maybe mu January sky tenzona monga mvula konse kuiriko.
And now the whole district is seeing more produce.
Currency is data. you know. And when we merge this, you know, this technology and agriculture, the currency becomes stronger. The currency becomes usable, not just for commercial farmers, but for small-scale farmers. And that is where I believe the challenge is. How can we translate this important data now that I need to help with my precision farming in whatever scale of farmer I am? How can I use that to actually increase my yield? When we talk about food security, everyone is talking about how can we increase yield for small-scale farmers. And that information is key, because as I have that information, I can increase my yield, which feeds now into food security.
Cassandra and her AgriPredict are true national heroes.
I was thinking of, you know, if I would see a farmer, you know, on the news, and I was thinking they have a family, they have children to feed, they have children to take to school. And because of this unfortunate incident of their crops being affected, it had such a ripple effect. It wasn't just about them. It started with them, but it ended up being their families, their children, their community, and then as a whole, the nation.
The future of agriculture in Zambia is looking up. Technology, information, and cooperation will make shining examples of hard-working farmers like Gordon, who will continue to feed their countrymen and indeed their entire region. On average, a Zambian woman has 4 to 5 children. Statistics show 40 births per 1,000 people, double the global average. And yet, prenatal healthcare is not available to a majority of expectant Zambian mothers. Communities in sub-Saharan Africa and Southern Asia see almost 700 women die every day attempting to give birth. The lack of information and facilities are the main drivers of this shocking death toll. The solution to these problems? Technology, thanks to innovative thinkers like Tafazo Munzwa.
Dawa Health is a Zambian health tech startup that's focused on democratizing access to primary health care.
Okay.
We have a network of clinicians who operate in the field. We also have a health platform that essentially are able to identify potentially high-risk patients who we then refer to higher centers where they can get intervention. And lastly, we are utilizing a network of community-centric people or community healthcare workers who are able to feed into that network.
The glue that would hold the operation together, a smartphone application.
Dawa Health app is an app that actually makes it easy for pregnant moms to have safe and easy pregnancies, and that's through AI. Because one of the things that we had found out is that most of the moms die because they don't know the fact that they've got issues. One of the most common is actually BP, and so most of the moms don't get to know that they've got high BP or that it's low, and that it puts them at risk until it's quite fatal and it's then too late.
You see your legs are swelling up, quickly come to the hospital. We want to make sure everything is okay.
Besides Zambian mothers, Munzwa and his team wanted to make a difference for another group, health workers. While there is plenty of opportunity for merchants, people preparing food and fixing things, there are not so many jobs opening up in the medical field.
Okay, so Dawa, in our application, we've come here to look for pregnant women. When we get those pregnant women, we educate them, because we've discovered to say we have pregnant women that don't go for antenatal services on time.
Okay, all right. I'm kind of asking if you can allow her to hold the baby so that I can see. Our client walked in, and we wanted to check her weight first of all. The first thing is to welcome them, to make them feel at home. So I checked her weight. Now I'm checking her vitals. You need to have a diastolic that is less than 90. We want to have a systolic that is less than 140. We've had cases of hypertensive disorders in pregnancy. It's one of the problem that we are facing right now. This is an expecting mom. We need to see also how the baby is doing. This is a Doppler ultrasound that will help me to see the baby's heart rate. I was supposed to also check random blood sugar. It's very important to see also whether they're within the accepted range. You make sure you eat a balanced diet as well. Your vegetables, your meat here, your carbohydrates there.
Dawa Health has put Judy and Regine to work, earning a living from their training by generating revenue from the mobile app. But for their patients, almost all of their services are free.
Some challenges that we face is that some women don't want to get the services because they're like, why are you offering these services for free? How we deal with those challenges is that we just talk to them, we explain to them, we sensitize, and we just have a conversation with them to say, no, we are doing this because we want to help everyone here.
We give the services the whole day, and they are able even to make appointments. And there are times where a patient is very busy and they want us to go see them from their homes. So we offer antenatal services from the comfort of their homes.
The maternity kit are the things that mothers use when delivering. So everything was there, including the maternity pads, the soap, the surgical gloves, the blades. I needed that before my actual delivery date because pregnancy is undetermined. You can either deliver before 7 months, 8 months. So I needed that because it was important at that point. It made me feel nice and special because such things really happen. Yes, so it was the first time, and then I felt encouraged. There's a lot of things that come with pregnancy, so having been followed home felt nice.
A smartphone saving lives. Bringing newborns into the world, saving women from a tragic end, motivating young people to alter their futures, Zambians and so many Africans are using technology to change their world and their lives.